Deciding who's appropriate for total knee arthroplasty is more complicated than you would think. First, we really try to identify who has symptomatic arthritis. And what we mean by symptomatic is it's painful, it affects activities of daily living, and it is made worse by activities. So those are going to be the hallmark symptoms associated with arthritis. After you identify a patient with symptomatic arthritis, we also want to make sure that the patient has failed non-operative management. Non-operative management includes anti-inflammatories, physical therapy, perhaps steroid injections or gel injections. And then once you've failed non-operative management, we want to make sure that the patient is likely to be able to successfully recover from the surgery. Sometimes that means patients who are advanced age, up into their upper 80s or 90s, or patients with severe chronic medical illnesses may not be appropriate for joint replacement. Preparation for total knee replacement involves multiple steps. First, all patients must understand the procedure and the expected recovery. This requires that patients develop reasonable expectations. Most of our patients stay in the hospital one night. They are considered homebound, which doesn't mean you have to stay at home, but it means it takes considerable difficulty to leave the house for approximately 1 to 2 weeks. And then patients should understand that there'll be some post-operative pain during the recovery period. The second phase is understanding what they can do in terms of their living arrangements to prepare for the surgery. This really includes talking to your employer, checking your benefits, making sure you have time off to fully recover so you won't feel rushed when it's time to return to work. It also involves making some modifications around your house. If you normally sleep on the second floor and your house gives you the opportunity to put things on the first floor, then it may be beneficial to make living arrangements on the first floor. It would be beneficial to make sure your house is clean if you're doing the house cleaning, because it may be very difficult to do that after the surgery for several weeks. It would be beneficial to make sure you have adequate grocery supplies and perhaps even pre-cooked, pre-packaged meals so that it will limit the meal preparation. You may also want to talk to family members or people at your church who can help you in the immediate recovery period. You don't need someone with you 24 hours a day, but you would need someone you could call on to perhaps bring you groceries if you needed them. You may also need someone to help you drive for a period of time. Most patients can get back to driving within a month, but I usually recommend trying to get patients off of the stronger pain relievers prior to returning to driving. And I recommend that patients recognize that they have some impairment for several weeks after joint replacement because of the ability to push on the brake rapidly.